Hello everyone. Today, we're going to talk about a very specific and sometimes unsettling symptom, the feeling of a clogged or full ear. While this can often be due to something simple like a cold, for many people, especially those on certain medications, it can be a sign that something more is going on. This presentation is a guide to understanding what your body might be telling you through this symptom, and what you can do about it safely. Many of us are familiar with the side effects of medications. We know diuretics, or water pills, help our bodies get rid of excess fluid. But what you might not know is that in this process, they also cause your body to lose important minerals called electrolytes. Your inner ear, which is responsible for both hearing and balance, contains a very specialized fluid. The balance of electrolytes in this fluid is critical for its function. When a diuretic causes a rapid loss of electrolytes, it can throw this delicate balance off, leading to that uncomfortable feeling of a clogged or full ear. So what exactly is an electrolyte? Think of them as tiny, electrically charged minerals that are essential for countless functions in your body, from making your heart beat to helping your nerves send signals. Diuretics can cause a loss of several key electrolytes, particularly potassium, magnesium, and chloride. We'll look at each of these in a moment, but remember that a drop in any one of them can contribute to the sensations you're feeling. To understand why this is happening, let's take a quick look inside your ear. Your inner ear is a marvel of engineering. It's a fluid-filled system that houses thousands of tiny hair cells that detect sound and movement. The fluid inside, called endolymph, is unique because it's rich in potassium. The hair cells rely on this specific balance to send signals to your brain. When a diuretic works very quickly, it can disrupt the balance of this fluid, making it harder for these hair cells to function properly. This is what you perceive as a feeling of fullness or a clogged ear. This clogged ear sensation is often a temporary symptom, and that's good news. However, it's a critical warning sign that should not be ignored. If you experience this sensation along with more severe symptoms like sudden hearing loss, severe dizziness, or chest pain, you must seek immediate medical care. While a temporary symptom might go away, repeated electrolyte imbalances can lead to long-term or even permanent damage to the inner ear. It's your body's way of telling you that you may be at risk for a more serious condition. It's also important to remember that not all clogged ears are caused by diuretics. The article mentions several other common causes, and it's essential to consider them. It could simply be impacted earwax, which is a very common issue. It could also be related to allergies or a cold affecting your eustachian tube. We also need to be aware that certain other medications, like some antibiotics, can also affect the inner ear. If the symptom persists, it's important to rule out these other possibilities with your doctor. What can you do if this happens? First and most importantly, do not panic and do not self-medicate. Taking too much sodium or potassium on your own can be dangerous, especially for those with heart or kidney conditions. The article's best advice is to take safe, measured steps to gather information. You can try a controlled observation. If the clogged ear starts, try consuming a small, healthy food item you already eat, like a few almonds, and see if it makes a difference. Most importantly, you should be meticulously tracking your symptoms, fluid intake, and weight. This information is invaluable for your doctor. When you do get to see your doctor, your detailed notes will be key. They will use this information, along with a blood test, to understand what's happening. A great point from the article is that since the electrolyte shifts are rapid, your doctor might recommend timing a blood test to be done shortly after you take your diuretic. This helps them get a more accurate picture of the transient imbalance. Based on this information, your doctor may adjust your medication, recommend specific dietary changes, or prescribe targeted supplements. If your symptoms are persistent or severe, your doctor may recommend you see a specialist. An audiologist can perform a detailed hearing test to objectively measure if there has been any hearing loss, which is important for identifying any long-term damage. An ENT, or ear, nose, and throat doctor, can also examine your ears to rule out other causes like earwax buildup or structural issues. This multidisciplinary approach ensures you get the most comprehensive care for your symptoms. To summarize, the key things to remember are that a clogged ear sensation from a diuretic is a warning sign of an electrolyte imbalance. It is manageable, but you must not try to treat it yourself. The most important actions you can take are to listen to your body, track your symptoms, and communicate with your doctor. By doing so, you can work together to find the right balance for your medication and prevent any more serious, long-term issues. Thank you for your time.